Hi, everyone. Good afternoon. Thank you for joining us for today's webinar about fostering mental well-being. My name is Abby Rose. I'm the Director of Implementation and Engagement at Catch Global Foundation, and I'll be today's moderator. Today's webinar is co-hosted by Catch Global Foundation and the Michael and Susan Dell Center for Healthy Living at the UTHealth Houston School of Public Health. CATCH stands for a Coordinated Approach to Child Health. CATCH was created in the 1980s. Its evidence-based school health programs addressed whole child wellness. CATCH Global Foundation launches kids towards healthier lifestyles by linking underserved schools and all communities to the resources needed to create and sustain healthy change for future generations. We do this by providing low to no cost, evidence-based curricula, including physical education, health education, social emotional learning, sun safety, oral health, and youth vaping prevention. We empower school communities to cultivate whole child wellness as a lever for student success and social equity. The Michael and Susan Dell Center's vision is healthy children in a healthy world, with a mission to advance health and healthy living for children and families through early and impactful interventions. Additionally, information about the center's work and resources can be found online. Please scan the QR code on your screen to access our health resources. The slides and a recording of today's webinar will be archived on our respective websites, msdcenter.org and catch.org. If you have any questions during the presentation, please enter your questions in the Q&A section by pressing the Q&A icon at the top of your screen. With that, I'm very excited to introduce our excellent speakers today, Dr. Roshni Koli and Michelle Rawcliffe. Dr. Koli is a board-certified child, adolescent, and adult psychiatrist, serving as Chief Medical Officer at the Meadows Institute and clinical adjunct faculty at UT Austin's Dell Medical School. She provides strategic medical leadership grounded in evidence-based care. Previously, Dr. Koli was the inaugural medical director of pediatric mental health at Dell Children's Medical Center and helped establish a full continuum of care in Central Texas, including programs like CPAN and TCHATT. Her work focuses on integrating mental health into primary and specialty care, reducing stigma, and promoting parity between mental and physical health. She earned her medical degree from St. George's University, completed psychiatry residency at the University of Illinois at Chicago, and a child and adolescent fellowship at Lurie Children's Hospital at Northwestern University. Michelle Rawcliffe is the Curriculum and Content Manager at Catch Global Foundation and a veteran health educator with over 25 years of experience. She has taught middle school health, held leadership roles at multiple levels, and collaborated with national organizations, including Shape America, Karen Guidance, and Erica's Lighthouse. A former Vice President of Health for the Connecticut AFERD, and 2022 Connecticut Middle School Health Teacher of the Year, Michelle brings deep expertise in skills-based health education, social-emotional learning, and coordinated school health. She holds degrees in health education and public health and lives in Connecticut with her family. In her free time, she enjoys hiking, gardening, baking, and traveling. Michelle likes visiting family and friends in the UK and spending time with her rescue cat named Greta. Now I'll hand it over to Dr. Koli and Michelle with their presentation on fostering mental well-being, strengthening support systems at home, school, and beyond.
Thank you so much, Abby. It's such a pleasure to be here with you all today and looking forward to talking a bit more about how to foster mental well-being for our children and families. Gonna actually share slides here, just a moment. Okay. Can you see that okay? Are my slides coming up all right? Okay, perfect. So I wanted to start with just talking about a way that we think about the Meadows Institute and our current system of mental health care delivery. The thing you'll notice on this slide is that when you look at physical health care delivery and mental health care delivery, they look very different. We know that many individuals, when they're seeking out care for their mental health or mental well being, it is often fragmented and they oftentimes come into the systems in crisis. Care is fragmented. Care may occur for a child or youth in a primary care setting, in a school setting, in a specialty care setting. And oftentimes, what we find is individuals don't talk to one another. And so, what we have found, and this has really been exacerbated in the midst of these last few years, is that we really have been looking at a crisis. So, when we think about the current state of pediatric mental health, just within the last few years, in 2021, the three major organizations looking at pediatric health and well being, American Academy of Pediatrics, American Academy of Child and Adolescent Psychiatry, and Children's Hospital Association, declared a national emergency in child and adolescent mental health. And this was really in the context of seeing worsening depressive and anxiety symptoms, worsening symptoms of crisis, and increased suicidality and suicidal ideations. The silver lining of this was that it really showed a light on the importance of looking at not only addressing our crisis, but also looking at what happens before as we can start to think about prevention. So, knowing that we're talking a little bit about different support systems throughout our community, I wanted to share a little bit about the Youth Risk Behavior Surveillance System data, or YRBS for short. So, the YRBS is a set of surveys that track behaviors that can lead to poor health in students' grades 9 through 12 and are administered every other year. They help to give us a sense of what adolescents are experiencing in their school. So, as you can see, when we look at the trends over time from 2011 to 2021, in nearly every category, we are going in the wrong direction. We're seeing an increased number of adolescents who are experiencing symptoms of sadness or hopelessness. We're seeing an increased number of individuals that are experiencing poor mental health. And we're seeing an increased number of suicidality as well. And one slide that I will kind of focus on here is, this really looks at the data of percent of respondents who didn't go to school because they felt unsafe. And in the light blue there, that sort of teal blue, represents the United States as a whole, and the dark blue is Texas. So something that you can see here is that in Texas, we actually have a higher number of individuals who responded that they didn't feel safe at school. I'm going to go through these slides quickly just for the sake of time, but the YRBS data is really something I would highly encourage you to look at. It is very helpful to get a sense of where adolescents are year over year. I wanted to spend a minute talking about the ideal children's mental health system. So, as you can see here in this graphic, specialty care and specialty care, physical health care and mental health care look the same. We see that for children, we don't think of children as mini adults. We recognize that for a child or adolescent, we have to think about a family systems approach. Children don't exist in isolation, and we can help them best when we understand their environment and the world around them. So we look at all of these factors that contribute: community, school, faith, home life, and family. And we really look at this best practice is to think about integrated primary care. We know that there is a significant workforce shortage in the number of pediatric mental health clinicians, be that psychology, psychiatry, clinical social workers. There are not enough specialized mental health clinicians to address the entire spectrum of mental health concerns that have arisen in our child and adolescent population. So we have to think thoughtfully and we have to really think, where do children look for care? And that initially is with their pediatrician, and sometimes that's within their school settings. And so, what you can see here is that we're really looking at the opportunities for prevention and early intervention. We know that through processes of things like universal screening, that we can catch things early. We can really start to recognize symptoms of depression or anxiety or ADHD before they become a crisis. And we have a unique opportunity to really be able to think about how to provide services early on when they're more effective. We also know that mental illness is a pediatric illness. Half of all conditions can present before the age of 14 and 75% before the age of 24. And so we know that we have this unique opportunity to be able to address things early on. On average, it takes 8 to 10 years before a child or adolescent is able to get connected to good evidence-based treatment for their mental health concerns. We have to do better. I've provided you with some pretty dire statistics, right? Some very things that can oftentimes feel like we lose hope. But there's a few things that I want to focus on that bring me hope when I look at this entire infrastructure of services for pediatric mental health and well-being. So, in the state of Texas, we have actually seen a significant increase in the amount of funding that has been dedicated to mental health. At the Meadows Institute, we really function at the intersection of policy and programs. We look at how to integrate best practice solutions at every level of care to ensure that every individual in Texas and the country are able to get the mental health care that they need, when they need it, where they need it, and by the right person. So, the thing that I'll highlight here is that as you look at in the last legislative session, Texas invested over $11 billion in mental health. That's a huge amount. And when we'll talk a little bit more about what that looks like for pediatrics. So back in 2019, there was a hallmark bill that looked at creating the Texas Child's Mental Health Care Consortium. And this created an array of infrastructure and opportunities to be able to catch things early, to be able to provide infrastructures where we can ensure that children's mental health needs are being recognized. So there's a couple of key initiatives, CPAN, TCHAT, CPW, our community psychiatry workforce expansion, and then some research initiatives. I'm just going to highlight a couple of these. This first one is CPAN, or the Child Psychiatry Access Network. This is a phone consultation line that offers real-time access to all pediatric primary care providers. Within 30 minutes, they can get connected with a child psychiatrist to be able to talk about what they're seeing within their office. It can be advice about diagnosis, assessment, and even connection to tailored resources in the community. There's also an opportunity for education through CMEs and webinars. And there's also an opportunity to have a one-time direct telehealth consultation with a child psychiatrist. The reach of this program is immense. One of the things that I do in my clinical time, my non-Meadows time, is I take call through CPAN one day a week, about a half a day a week. And it brings me incredible joy to be able to support pediatricians in this way. You'll see some of the statistics here. We've completed over 47,000 consults since the program was incepted. And we've reached so many individuals and supported a great number of pediatricians. TCHAT is the other one that I want to highlight here. The Texas Child's Health Access Through Telemedicine is a unique telehealth-based school program. So it's a way in which when mental health concerns are identified at school, children and students can be connected to evidence-based services through their local health-related institutions. And so they're able to see a licensed provider for purpose of a diagnosis and brief intervention and stabilization. This is, now doing work across the country. I will tell you that TCHAT is the most comprehensive school-based telehealth system that exists to address mental health concerns for children and adolescents within our country. New funding from the last legislative session actually allowed these services to be available in any district that wants them in the state of Texas. I'm going to skip these and I'm going to highlight one final program, which really is what brings me a ton of hope in terms of how we can really look at addressing this youth mental health crisis early. So, when we think about recognizing that more and more pediatricians and pediatric primary care providers are seeing children and youth with mental health concerns more than ever before, And every day, pediatricians are oftentimes sharing with me that they are feeling more overwhelmed and under-equipped. Pediatricians, not all were trained in being able to address pediatric mental health concerns. And so we have to think about how do we create a system of support for these pediatricians. And there's a couple of different ways to do this. I like to think about it as an integrated behavioral health continuum. So you have your peer-to-peer consultation programs like CPAN. You have co-location where there may be a licensed clinician that is embedded within a practice, able to see children and adolescents. And then you have your fully integrated care models like collaborative care. The essential components is making sure that there's universal screening, that we're tracking symptoms with evidence-based validated assessments. We're doing measurement-informed care, so we ensure that we are tracking symptoms over time in a systematic, evidence-based, validated way, so we can ensure that children are getting better. And if they're not, we have an opportunity to make pivots in treatment. And then the availability of a psychiatric consultant. We know that not every child and adolescent needs to see a child psychiatrist. In fact, many and most don't. And many of these individuals can benefit from care in the community or care with different clinicians and primary care providers. What we want to have within these integrated care models, though, is a really thoughtful way of triage, recognizing that when there is an acute safety concern, when there is a need for higher level care, that there's availability for individuals who are at sort of that higher skill level. And then I'll end with this. This final collaborative care model is one that we really champion at the Meadows Institute because it is extensively evidence-based, over 90 randomized controlled clinical trials. It is a team-based population health approach, and it's been shown to be effective in a variety of different settings. It essentially creates a team to support the primary care provider in caring for mild to moderate mental health concerns of their patients. And I will end with this. These are my boys. When I think about my why of why it's so important to create an infrastructure in which we not only recognize mental health crisis, we recognize when mental health concerns are presenting at any stage in a child's or adolescent's life. I think about it because for far too long, physical health and mental health have been looked at differently and separately. We have to do better for our children. And what brings me hope and what keeps me going is looking at creating a world in which children, all children, have access to the right type of care early on, have the language to be able to talk about emotions, and to have the knowledge to be able to recognize when they're struggling and the resources that are surrounding them in their communities to get the type of help when and where they need it. Thank you so much. Marella, I'll turn the slides back over. Thanks.
Thank you, Dr. Koli. As a parent of a child who was diagnosed with major depressive disorder at a very early age, I appreciate everything that you're doing to move the field in the direction that you're moving in. It's incredible and inspiring. So I appreciate everything that you're doing. As previously mentioned, I'm Michelle Rawcliffe. I'm a K-12 health educator who taught for nearly 25 years in the public school system, and now I'm the curriculum and content manager for Catch Global Foundation. And when I taught, ever since I first started in the late 90s, I was extremely passionate about youth mental health and have been so ever since. So I'm grateful for the opportunities to share the what, the why, the who, and the how for supporting a conducive school environment where mental health and well-being is openly fostered, discussed, and prioritized, and perhaps the connection to some of those resources that Dr. Koli was referring to. Next slide, please. So unfortunately, this has already been mentioned. Sorry, I just lost my notes. Something interrupted my internet for a second. Okay, so first, the what. So determine what supports are in place for mental health literacy education in your community. That could be district and state policies. So it sounds like in Texas that those exist and are supportive to mental health
education within the schools. It could be incorporated into other initiatives like substance misuse prevention or suicide prevention, but there are policies out there to encourage this. For example, and most states have them. For example, in 2018, New York State released a mental health education framework, which is fantastic. And they clarified that a satisfactory program in health education must include instructions in several dimensions of wellness, including mental health and the relationship between mental and physical health. And it also should enhance students' understanding, attitudes, and behaviors that promote health, well-being, and human dignity. So Catch Global Foundation, what we did is when we created our health ed journeys, we aligned our health ed journeys to this New York State framework, and that is available on our website. So this helps educators who are preparing for mental health literacy education. It allows them to take that guesswork out of what is going to align because we've already done that for them. And then they can focus on nurturing those relationships with the students. Similarly, Catch has documentation showing alignment to California's Senate Bill 224, which mandates mental health education in middle schools in California. So we have documentation to over 10 states for 10 state and national standards that are available on our website. From my personal experience, I was able to emphasize mental health literacy education in my home state of Connecticut because it aligned with Connecticut General Statute 10-16B, which is one we cited a lot to support what we did in the health education classroom. And that simply said that health and safety education is required in the state of Connecticut, and students must graduate with 1 credit from high school, 1 credit in health, and that needed to include mental health education. Also, many states have initiatives that support the Safe and Supportive Schools initiative. So that could mandate or encourage districts to have a school safety plan like ours did that incorporated mental health education as part of the plan to reduce bullying and improve school climate. It's also important to look at resources because with some of these initiatives, there are resources that are available on the websites from where those initiatives are coming from, like the State Department of Ed. I've gone on many state websites to look at some of these mandates or bills, and they often link to resources that are available to help districts implement some of these. Also, there are regional behavioral health action organizations in some states, like in mine, that aim to maximize resources and improve integration in mental health and substance use program planning, training, advocacy, and resource development. Shout out to CIRAC, which is my local. Through that, I was able to get trained in youth mental health first aid as a classroom teacher for free because it was supported through their funding. And then also, it was my introduction to Catch My Breath, which is Catch's vaping prevention program. I was able to participate in that training for free through funding from our RBHAO. Try to go quickly through this. So school-wide social and emotional learning, there are a lot of great resources out there that address mental health literacy development and the facilitation of social emotional competencies within the school system. So there's 2 different types. There's character education and social and emotional learning, and both can complement each other and help teach those critical skills that they need in schools. Whatever it is, it should be focused on skill development, like social and emotional competencies. CASEL is another great resource that clearly outlines those social competencies that a student should have. And we map rather, our health ed journeys curriculum and a lot of our other programs like our SEL journeys to those CASEL core competencies. Another thing that a school can do to support this is to have a school wellness team or someone like a school wellness champion like me is going to need to coordinate all that so that it is a whole school approach. The Catch Coordination Kit is Catch's resource for a school-based wellness champion or team to serve this purpose. I wish I had that when I started my wellness committee. It's a one-of-a-kind resource that guides wellness
school wellness teams through a yearly sequence of health and wellness promotion. And the goal is to build upon existing school assets like wellness champions and priorities so that health and wellness become an integral part of the identity and the culture of the school. So we know that mental health is multifactorial. So Catch's holistic approach, kind of going back to what Dr. Koli was saying before, how physical health and mental health is often separated. We don't believe that it is at Catch. And so that could really complement her efforts to advance the care that's occurring under her direction in Texas to have a holistic approach towards child health. So, for example, we provide physical activity, nutrition, substance misuse prevention, and programming for a positive school climate, all of which support mental well-being. And then systems, policy, and environment. We've talked a little bit about this. Catch's fundamental premise is that behavior is influenced or determined by the environment. So by creating and maintaining safe, supportive, and healthy environments in conjunction with mental health education, we can achieve positive behavior outcomes in a sustainable manner. And so our Catch Coordination Kit can help you do this. And in the classroom, and I promise this is the last thing on the slide, and I will try to go quick, but it is one of my favorite things to do because it fueled my passion as a teacher, is to really focus on mental health literacy education in the classroom. So regardless of how it's done, it should be backed by data, evidence, and theory and taught within a safe and supportive classroom. So it could be focused just on mental health literacy with a little bit of content. And what that would cover is mental health, recognizing mental health challenges so that you're teaching that to the students, even as young as elementary school. You can reduce stigma, know how to seek help and support themselves and others when they recognize that either they're in crisis or there's something that's happening, or they're becoming more familiar with mental illness in their family and they're communicating about it and how to get help for themselves or other people. So objectives can center on knowledge acquisition with some skill development, especially empowering them or enabling them to seek help if they need it for themselves or other people, but also promoting mental health and well-being for other people. So this could be a standalone program, or it could be within a comprehensive health education unit or curriculum like we have with Catch Health Ed Journeys. Catch Health Ed Journeys, every curriculum we have in grades K through 8 has a unit solely dedicated to mental health literacy education. You could also do this in a skills-based approach, where if you're teaching a skills-based approach, you could focus on teaching a skill like analyzing influences, which aligns to one of our national health education standards. And you can use the content of mental health literacy to reinforce that skill. So if it's analyzing influences, what influences my mental health and well-being? How are they helpful or not helpful? And then how can I mitigate those unhelpful influences and really highlight the ones that are helpful? Next slide, please. So I don't really need to focus on this because I feel like everyone's here for the right reasons. And they already know this. And Dr. Koli spent a long time talking about this. But the impact of poor mental health on learning is well documented, and I saw it in my years. I witnessed it firsthand. I saw as the rates of depression and anxiety were increasing, I observed a direct correlation with an increase in students struggling academically. I also noticed a rise in dysregulated behavior, classroom disruptions, and difficulties with focus and attention, as well as poor social interactions and other behavioral issues. So these challenges are hard to manage in a classroom and teach at the same time. And it's led to reduced instructional time for all students, but particularly for those that are in crisis. And when the mental health of everyone in the classroom, in the school is prioritized, it can foster fundamental skill building that extends well beyond the school and into adulthood, ultimately benefiting our workforce, our families, our community, but primarily our students. If our students are mentally healthy, then they are going to be ready to learn, and our classrooms are going to be a joyful place again. If we can get to that place where mental health is prioritized, our students will be more ready to learn, and our teachers will be more able to teach. Okay, my little soapbox. So when And in addition to that, when we prioritize mental health, we can then build upon that. So if students are in a place where they are mentally healthy, we can build upon some of those other programs that we try to implement, like the character education and other skill building. They need to be in a place where they're ready to learn. And I think if we prioritize mental health, we can get them there. And ultimately, it'll benefit not only our school community, but beyond. Okay, next slide, please. So who does this? In my district, it was mostly me. But you need at least one champion to coordinate efforts. I was that person. I led the implementation team in my district for our school-wide social emotional learning program. I embraced the training. I loved it. And then I was an administrator for it. So I led professional development for my peers. And I supported them in their implementation of the tools and resources with that program. Ideally, if you're an administrator out there, we would, as teachers, love it if you were the lead in these efforts. However, teachers can have a powerful impact on their other teachers, their co-teachers, their peers, and the students if they embrace the program. And I love this story because we had to lead a lesson on emotional regulation and figuring out, how people react differently or express emotions differently. And a teacher created a school appropriate playlist of songs, and the students would listen to the song and then move to a corner of the room that best described how they felt when they heard that song, and then move in the space how that emotion felt in their bodies. And the students had a great time. They learned that everybody is going to feel a little bit differently about things, and then they learned how to communicate those feelings and how to express them effectively and appropriately. And the students loved it. The teacher embraced it, and then other teachers saw that, and then they embraced it, and then we got some buy-in for the program. Wellness teams. So school health advisory councils, wellness teams are wonderful. I know Texas has school health advisory councils, but they are a wonderful way to center mental health literacy and mental health among young people. And our Catch Coordination Kit will help a wellness team do this. It gives a framework for those school year-long approach that champions can rely on, like school-wide anchor activities. And there's an example I'm going to show you from a Catch community in Michigan that embraces health and at a school-wide district level. All right, so next slide. And I think, Maribel, you're going to have to play the video.
My name is Renee Wilkinson from Ely Elementary in Whitehall, Michigan. As a staff, we've collectively become Catch MVPs and continue to promote healthful choices through our own actions. So far, our promotions include Getting Caught with Go Foods and the Healthy Spirit Week themes. Next, we're going to dive into what it really means to be ready, mind, heart, and body.
I'm a fourth grade teacher at Ely Elementary in Whitehall, Michigan. Every day we set our intentions during our morning meeting using these mindful statements, being mindful of our thoughts, mindful of our words, mindful of our actions. And sometimes, depending on how students are feeling in the morning or our previous day's experiences, I'll ask them to pick one of those to focus on to help guide them throughout the day. And the result is them realizing that they have more control when they are paying attention to what they're thinking and what they're saying and what they're doing. And then, of course, at the end of our meeting and the end of our mindful statements, we always send everybody out into the work of the classroom by saying many blessings. It's our way of wishing them good things throughout the day and reminding them that they are worthy of good things and blessings to come their way throughout their day.
Be mindful of our thoughts, be mindful of our words, be mindful of our actions.
So cute. So there's so many things that you can do in a school to center mental health. The wellness team, like we said, using the Catch Coordination Kit to use that common language. There's also data-driven initiatives where what I would do is I would look up any sort of data on my school and incorporate that into my lessons. I would also talk to the assistant principal to find out what are the behavioral referrals that they're getting, and is there a common theme, and can I address them in my health education classroom. There's also other champions and counselors in your school that can help. I loved working with my behavioral health staff and sitting on student assistance teams so that I can learn more about what my students needed. And then I would work a lot with my school psychologist, who could then help me become a better teacher in this topic area, but also she would sit in on some of my classes to learn about the language that I was using so that she could use the same language with the students that she was working with. And they also, if they can embrace the program too, they provide endless professional development. It was really great to work with them. And then the family and community engagement, most families and communities that I've experienced support mental health literacy education in school. And so kind of like what Dr. Koli said, look at those resources and what's being done in your community and work with them to just further support your school and your students. And we do need mental health professional learning for our teachers. At Catch Global Foundation, I'm going to talk a little bit about this more. We do support some professional learning in mental health education and our campus coordination efforts. So I'll talk about that in a few more slides. But first, for next slide, please. I wanted to take a moment for a mindfulness activity. We're almost done. I have a few more slides. So you can do this with me. You don't have to. You can close your eyes if you want. You don't have to. This is a free activity that is available on our Educators Club. If you do feel like doing this with me, just follow along. You can do this with students or by yourself at your office if you'd like. So first, you're going to put your hands on your head and you're going to focus on your mind. And you're going to take a deep breath in and you're going to send calming energy to your mind, or just send the word calm to your mind. And I'm going to try to put on my NPR voice for you. All right, breathe in and send that calm. And exhale. Next, you're going to put one or both hands on your heart and you're going to focus on your heart. You're going to take another deep breath and send calming energy to your heart, or send the word calm to your heart. Breathe in and breathe out. And finally, you're going to focus on your whole body. You're going to take a deep breath in and you're going to raise your arms as you inhale. So take a deep breath in. And then lower your arms as you exhale. As you do this, send calming energy to your body, or send the word calm to parts of your body. Thank you for doing that with me. Next slide, please. So like I said, this came from our Educators Club. It is freely available resource to everyone, and its resources change monthly. We have really cute little dances and recipes on there. Definitely check it out. It is dedicated. There is a whole section dedicated to mindfulness. Many of our resources are available in both English and Spanish, and users can view all of our professional development tracks and schedule a training at any time. Again, a lot of the materials on this section of our site are free. Next slide, please. So many of our professional development options do not require you to use Catch programs in your district. Our Tier 1 mental health education professional development track is a 1-hour virtual or in-person session where participants will learn how to implement Tier 1 mental health education in a standards-aligned curriculum and strategies to create school culture promoting whole child wellness. If you're interested, you can scan that QR code on the screen now, or we will also include this information for this training in the email following this webinar. If you scan the QR code, You are able to find information about all of our tracks. And as you scroll down, you'll see a request information form. And so this form allows you to contact someone at Catch directly so that we can learn more about your needs and how to best approach them. And as you're ready to fill your information in, just let us know that you are interested in this Tier 1 mental health education professional learning. Professionals in Texas and California, we have a grant through Delta Dental Community Care Foundation, and our training can be available at no charge in order to support state mental health requirements. And we have a specific code for you. So this code is specifically for you if you are interested in learning more about that training. And this is my last slide. So this is just a quick checklist as a guide moving forward to ensure that you include the things that you want to include when reinforcing mental health literacy as a focus in your community. I might also incorporate some of Dr. Koli's wonderful resources for my own state in there if I were to do this, because those are just some amazing assets, and I'm so hopeful to see that those are there. And again, utilizing our Catch coordination kit, I can't stress this enough because I really wish I had this when I was starting and facilitating my school health advisory council by myself. Even if you don't have Catch programs in your school or district, you can use the Catch coordination kit in combination with any PE, health, and SEL programs at your school or district. It's a digital resource and offers school-wide social emotional learning concepts and activities embedded into each section of the kit. And many of the resources, again, are available in both Spanish and English. And now I'm going to pass it off to Abby for some question and answer.
All right. Well, thank you so much, both to Dr. Koli and to Michelle, for those amazing presentations, chock full of great information that you can take back with you. I'd love to see some questions in the question and answer channel there. If you haven't done so already, make sure to open up that question and answer icon and put a question in the box for either Dr. Koli or Michelle or both. In the meantime, as we're waiting for any questions to roll in, I'll just kind of throw it back to each one of you. Dr. Koli, do you have anything to add, that you didn't get to or that you want to kind of emphasize?
Thanks so much, Abby. I actually do see a question in the chat about best practice to encourage family engagement, and I think that's such a wonderful one, and something that I didn't talk about as much that I would love to answer. I think when we think about how to be able to best provide help and resources to children and adolescents, I think about it in a family systems approach. That if we could provide the very best treatment and care to a child or adolescent, but if we are doing it in isolation without involving the family and without engaging the family, then our services and our approaches won't be as effective. And so I think all of this kind of goes within how do we engage families? If a child is struggling with mental health concerns, likely their family is also struggling as well. And by that, I simply mean that if a child is struggling, a parent may have questions about what do I do? How do I help? What are tangible things that I can do? And so in all of the services that I talked about, from CPAN to TChat to collaborative care to kind of creating this infrastructure, I think about all of them with how do we embrace families in being able to ask questions, creating a safe and open place to do that, and providing good and thoughtful education.
Those are great insights. Thank you so much. And I now see a couple of questions in the in the Q&A section. So thank you. This one, I think, Michelle, this would be directed to you. When considering a health education program targeted to parents to support their children's mental health, what topics do you think are most pertinent to include?
That's a great question, and I'd be curious to hear what Dr. Koli thinks as well. We did a book study in 2 different book studies, and I thought it was really helpful. One was on Middle School Matters, and we met weekly with parents to discuss the book, and a lot of mental health topics came up, and we had we had a local psychologist, child psychologist, join us and talk about reducing the stigma, recognizing symptoms. And that was really helpful because sometimes it's hard to know what symptoms to look for unless you've been openly talking about it in your family for years. The other book study I was part of was on anxious generation. And that was interesting. I had a hard time reading that book as a parent of a teenager. So I think it's partnering with reducing stigma, recognizing symptoms, and then connecting to resources that are within your specific community, or if you don't feel comfortable going to resources that are in your community, find some that are within your network and maybe just a little bit outside your community. But just those three things: stigma, recognizing signs and symptoms, and connecting to resources.
I love that, Michelle. I think you captured it perfectly. I think those three fully resonate with me and totally things that I would agree with. I also think that stigma one is really important. When a child is diagnosed with diabetes versus when a child is diagnosed with depression, we as a community, as a society, look at those things very differently. If we can start to bring some of that stigma down and sort of a reminder that emotions are common, emotions are normal. What do we do when emotions start to feel out of control, and what does that look like? And this recognition that help is available. So I think really recognizing what is sort of normal on the spectrum of sort of experiencing different aspects of emotions, all children and adolescents and adults do. And then when do you know that something is wrong? When is there like persistent symptoms of sadness or hopelessness or difficulty engaging with school or with friends or engaging in sports? When do you see differences in where a child doesn't feel like that same child and that same personality and that same engagement? So I think really just providing that education. And I think I imagine that Anxious Generation one was a hard book club topic. I think if there was number one most asked question, that probably is it. And, I think really addressing and having conversations about the role of social media and screens and how do they affect all of our mental health and well-being. I don't think it's as simple as there is one cause. And Michelle, you mentioned this earlier, that mental illness is multifactorial, right? There are many different aspects that contribute to an individual's mental well-being and mental health. So I think we really have to think about all those contributing factors. And then I think it's another nice way to be able to engage parents. I've oftentimes in school settings or in hospital settings just say, parents, what are you interested in? What's on top of mind? And how do we sort of meet some of those needs?
Can I ask Dr. Koli a question? Because I think it relates to that. So you had said that a certain percentage of students are not identified or diagnosed or getting connected to treatment until the age of 14, and then another percentage before the age of 24. Do you know those percentages offhand? Okay.
Absolutely. So it's actually it's about 50% of all mental illness occurs before the age of 14. So an individual may not get diagnosed, but when they look back at their life, they'll recognize, or their families will recognize, that there were symptoms of mental illness that occurred before the age of 14. 50% of all cases. 75% of all cases of mental illness occur before the age of 24. And that really is saying that again, but at the same time, and I think this is what you were getting to, this doesn't just students, but all children and adolescents. It takes an average of 8 to 10 years to get connected to treatment, to have a diagnosis and to start getting treatment. And that's a huge delay, right? So that means that many times symptoms and signs of mental illness present in childhood or adolescence, but treatment may not occur until early adulthood. childhood. And we know that for any other health condition, if we let diabetes go untreated, it is going to become more severe. And that's the same as it relates to mental illness, that if we are not able to get connected to treatment and recognize symptoms early, oftentimes things get worse, and oftentimes individuals will have more of a likelihood of presenting in crisis.
Thank you. Yeah, one of the questions made me think of that that I saw about requiring mental health awareness training, such as youth mental health first aid. I think that knowing that 50% of all mental illnesses occur before the age of 14, that's 8th grade. So educating those professionals to help recognize. And then another question came in, well, what do you do once now we're diagnosing students? What if we don't have the resources and access to care? I know only from my experience, we have school-based health clinics in Connecticut, and a lot of those provide mental health care first, and it's free to the families. And we have, community-based health centers have free access to free mental health care. So our school staff, they were trained to diagnose. One of our staff was trained to diagnose, but to refer to treatment, affordable and accessible treatment in the community. But curious if you have any questions or comments about that, just how to proceed once we've diagnosed children, whether it's in the school. What do we do about there's not enough providers and financial barriers?
Yeah, it is a very good point and a great question. I again will wholeheartedly agree here that I think schools are wonderful places to identify symptoms early and to be able to connect to really good evidence-based treatment. And then the question is, can the school act as sort of a convener or like a connector? I think that's the word I'm looking for. How do you connect to really good services within our communities? And I think it first starts with just looking at what services are available in each community. Oftentimes that's hard. And if I think about one of the biggest challenges with mental health treatment and care delivery, it's lack of care navigation and care coordination. Sometimes even for things that are available, for instance, TChat is completely free to students and families for up to 4 to 6 sessions, and even potentially longer if there's more pronounced needs or greater difficulty connecting with the community. But oftentimes people don't know how to access. And then I think that's the other place where if we don't know how to proceed, if whether it's a parent or a school, really thinking about the pediatrician or the pediatric primary care provider as central in that journey. Oftentimes the pediatrician is the physician that most families feel comfortable with. They've known the child often since birth, and they know the family. And so if we can, as a community, support pediatricians more in being able to identify, recognize, and provide some early intervention services, I think that can be incredibly helpful. So those are the two things. If I really think about our Texas community here, we do have access to some services within that. And I think we really are constantly looking at where are there opportunities for state and federal policy funding? What are the things we need to invest in? And part of that really is those integrated primary care programs we talked.
I agree. One of the comments too was, will these policies that like the Texas one that requires youth mental health first aid, will it improve school environment and improve school connectedness? And I think so. If, like you said, if we can connect young people to the care that they need early before it's too late, I think it will get them in a place earlier where they can feel happier and healthier. And I think prevent some of those problems that occur in a school environment that doesn't feel connected or doesn't feel positive.
It looks like we've covered all of our questions that are in the question and answer. Last call for questions. Otherwise, I want to say a big thank you to everyone who has attended today's webinar. As a reminder, the recording and the slides will be posted on msdcenter.org and on catch.org as well. And you will receive a follow-up email with a link to both of those, along with resources shared by our panelists. Additionally, we hope that you will join us on Wednesday, May 28th for a webinar about Active Travel, Active Lives, a public health perspective on school commutes for children. Thanks to both Dr. Koli and Michelle for being amazing experts and sharing their knowledge and resources. And thanks to all of you for attending. We will see you next time.
Thanks, Abby.